Hello, my name's Rob Webster. I'm the lead chief executive for the West Yorkshire and Harrogate Health and Care Partnership. We're really keen to understand how the Health and Care Partnership, both the NHS and communities and councils, can work together and harness the power of digital technology to help support our aims and goals. Now, this is really important if we think about care being safe, care being effective, and care being responsive. Those things define high quality. Our partnership is part of a national programme called the Local Health and Care Record Exemplars, or LICRA for short. So as we love acronyms, you might come across people talking about LICRA. They don't mean middle-aged men like me on their bikes on a Sunday afternoon. They mean a programme which is looking at how we do two very simple but very important things. The first is to allow data to be looked at and shared across the health and care system. So people can see your data as required so that you can get the right care in the right time at the right place, and that safety, effectiveness and responsiveness is assured. The second thing we want to do in the LICRA programme is give people access to their own data so they can carry it with them, they can add to their records, and they can get a greater sense of their own history and what's currently happening to them. This is really important because it can make a difference to people with long-term conditions and people with an ongoing history of support and partnership with the health and care system. Most of the money that we spend, most of the care that we deliver is for people who have long-term conditions. This programme could benefit a significant proportion of the population. If we look at the LICRA programme and those two simple aims of joining up information so that it can be read in the right places and giving people access and control over their own data, there are some significant benefits and some significant progress. We were able to join the programme, which covers the whole of Yorkshire and Humber, because we've already made some good progress in the Leeds Care Record, the Rotherham Care Record, and in some specific bits of work to give people access to their own data. 74 big organisations, over 700 GP practices are now involved in West Yorkshire and Harrogate, South Yorkshire and Bassetlaw, and Humber Coast and Vale in trying to make the sharing of information and the holding of personal information a reality for everybody. You might not be aware that 22% of UK digital jobs are in the Leeds City region. And with our partners, the Leeds Academic Health Partnership, with similar organisations in Sheffield and Hull, and with the Academic Health Science Network, we're looking at how do we create an environment where we can deliver that economic and that health and care partnership benefit. Through the development of an organisation called Habitat, we're looking at how do citizens and small businesses work to look at developments in a digital sphere that really make a difference to individual people and to particular groups. Habitat, led by Dr. Victoria Betton, engages with service users, patients, carers, families to look at their ideas and their approaches to improvements in the use of digital technology. So, for example, they've looked at, can you produce a peer-to-peer support platform where people with post-traumatic stress disorder can give each other help and support 24 hours a day, 7 days a week through social networking. It's really important to us then that we hear from you, communities and people about what they think about the digital agenda and what it means for their lives. Over the last year, we've worked with over 2,000 people in producing a report into attitudes around the digital agenda. That was published in a report called Joined Up Yorkshire and Humber, which you can read on the website. I think the LICRA programme will get us to the point where, by joining up data and giving people more control over their information, we'll be able to feel like the NHS and the care system is like the rest of our lives. It's enabled by digital technology and it feels like we've entered the 21st century. Thanks.